Dear students, today we'll be learning about the medial compartment of the thigh. And where we can see, you can see on this side, the inner aspect of my thigh is the medial compartment. And let's look at the medial compartment. My objectives are, first I'll be discussing the muscles, their actions, nerve supply, proximal and distal attachments. And the later part, we'll be learning about the neurovascular bundle. We have already discussed about the arterial pattern within the presentation of my anterior thigh. Arteries has been explained there. Now we are familiarized with this cross section. We have discussed about already the anterior compartment, posterior compartment, but what is not visible to you is about this medial compartment. So what is this medial compartment muscle group does? So those muscles who are included within my medial compartment of the thigh, their main job is they are the adductors of my thigh. At what place? At the hip joint. So they are the adductors of my hip. And then the nerve who controls them is the obturator nerve. That is also coming from my lumbar plexus. And now here you are looking at all those muscles who are contributing to my medial compartment of the thigh, and these are adductors. So let's summarize them. The medial compartment muscles, and what adductors we'll be learning today. Number one, we'll be talking about the pectineus muscle and the later, and this muscle is different. It's located with this medial compartment muscle, but primarily its innervation is coming from femoral nerve. Sometimes it's innervated by the obturator or the accessory obturator, but primarily its nerve supply is from the femoral nerve. And then we have the adductor brevis. The brevis means small, and then we'll have an adductor longus, and they are coming up. And then a big muscle, adductor magnus, has two components of this muscle. It has an adductor part and it has a hamstring part. And then last but not the least is the gracilis muscle. Now all these muscles are innervated by obturator nerve, but we have two exceptions. Pectineus, it is innervated by femoral nerve, and my adductor magnus, its adductor part is innervated by the same obturator nerve, but its hamstring part gets the nerve of my hamstring compartment, and that is the tibial part of the sciatic nerve. So these 2 points should be very clear within your minds. Now let's take one by muscle. So we are looking at the pectineus muscle, and we know about it. We can see that it's coming from the pectine pubis. There's a line on the pubic bone. It looks like, word pectine is derived from the comb, serrations, kind of tiny serration. If you look at a comb, it gives you that pectinate line. So this pectinate line is one of the feature which is there on the pubic bone. If you just know this much, enough. No need to go into the history of why it's called pectinate line and all that. So this is just the pectine line, and it's coming from there, and you can see it's going towards my proximal femur, and where is it attached? On the posterior surface of my femur. It's going on the posterior aspect, and it is innervated by my obturator nerve. And the job of this muscle is, we know it is one of the contributor in the adductors. And then we are learning about the adductor brevis muscle. This adductor brevis muscle, proximally it's coming from the body and the inferior ramus of the pubis. My pubis has superior and inferior ramus, so it's coming from the body and from the inferior ramus, and distally is going to the proximal 1/3 of the linea aspera. What is this linea aspera? Linea aspera, if you look at the posterior surface of the shaft of the femur, you can see there's a raised area. This line is called linea aspera, and so many muscles are attached to this line. And then this is also supplied by obturator nerve. One of the very characteristic point for this obturator muscle, obturator nerve, when it reaches to its upper border, here it bifurcates into an anterior division, and the part of the obturator nerve which goes behind it, that is called the posterior division of my obturator nerve. And then it adducts the thigh to the same extent. To some extent it flexes, but the main job we should be remembering what it is, the adductor of the thigh. And then now we are looking at a big one, and this is my adductor longus muscle, and this muscle is coming from the body of the pubis, and that is going to the middle third of the linea aspera. It's also going to the linea aspera, and we talked about it. And this adducts the thigh, and also it rotates the thigh medially. So it is also doing a medial rotator job, but primary job is adductor of the thigh at hip joint. and it's supplied by the obturator nerve. Now the big muscle, and this big muscle is adductor magnus, and it has two parts, an adductor part and a hamstring part. So adductor part, from where it's coming, inferior ramus of the pubis, ramus of the ischium, and then the hamstring part, it's coming from the ischial tuberosity, and then its adductor part, it's coming from where, gluteal tuberosity, linea aspera, medial supracondylar line, and hamstring part is coming from the adductor tubercle of the femur. So these are the proximal and distal attachments. And then the nerve supply, the adductor part is innervated by the nerve of the adductors, and that is the obturator nerve, and the hamstring part is primarily innervated by tibial part of the sciatic nerve. And then what is its job? What is its action? It adducts the thigh. Which part of this? The adductor part, and it also helps a little bit in flexion. The hamstring part is primarily, it extends the thigh. And then the last but not the least, this tiny looking muscle is my gracilis muscle. This gracilis muscle has very high clinical significance. It's not a very strong adductor, but this muscle is very likely used in different surgical procedures where this muscle can be used as a graft. Because if we supplement this muscle for some other job, if there is a need, not for a fashion, for a need, then the job of the adductors is not that much compromised, but what job has been performed by this gracilis is phenomenal. So this gracilis proximally is attached. You can see that body of the pubic and ischiopubic rami. So pubis and ischiopubic rami, and then distally is going to the medial surface of the proximal tibia. You can see that it's going down, and then it's also supplied by the obturator nerve. And then the obturator nerve, we talked about it, root value L2, 3 and 4. It's also coming from the lumbar plexus. Which part of the L2, 3 and 4? L2, 3 and 4 are spinal nerves and their anterior divisions. Posterior divisions were responsible, same L2, 3 and 4 for my femoral nerve. So obturator nerves coming from there, you can see that it is passing down and it's going through an obturator foramina, and then it obturator canal, so it enters the thigh, and in the thigh when it reaches to my this muscle, which is my, what is this muscle? Adductor brevis, and there it divides into anterior and posterior division, and you can see it's innervating the adductor longus, and then it's going to the magnus, and you can see that it's going to innervate my gracilis. You can see this before, here it's supplying to different areas, the obturator, all these muscles which has been innervated, they all has been shown innervated by my obturator nerve. So its motor branches, we have seen them, muscles of the medial compartment of the thigh, and its sensory branches, ischion over the upper 1/3 of the medial aspect of the thigh, and then there is an articular branch. You can see that this branch is going to this joint, and any branch which is going to a joint, we call them articular branches, and this is going, it gives articular branches to the hip joint and to the knee joint, both. Then let's review them. We categorize these muscles in two layers, a superficial layer, and what are these muscles? So you're looking at the pectineus, brevis, magnus, and gracilis, and this is their schematic picture. And then these are the deep layer muscles, and there you can see obturator externus is visible to you, and adductor magnus is being shown to you, and there is an opening there, that is adductor hiatus, and adductor magnus, its tendinous part. You can see that this is the tendinous part, and it's going to the adductor tubercle. And this is a table which helps you to understand all this what we have learned about. Guys, these tables I am taking from Moore Anatomy book. Thank you very much.